Hello everyone, hope everyone's having a great day. My name's Neil. If you haven't seen my videos, I have end-stage liver cirrhosis. So today's video, I wanted to talk about the procedures that go along with it, some of those different things that they do to not only check for the liver disease and to see where you're at, but also for procedures they may do to fix certain things that come up while you have cirrhosis. So if you want to know more about symptoms, there is a video a few back if you want to check that out that talks about the different symptoms and stuff. But this one is about the procedures. All right. So I'm going to start with initial inspections and things that they do to test. Generally, it starts with a blood test. There's ASTs and ALTs that are liver enzymes, and basically when your liver starts breaking down, these enzymes go into the bloodstream and they're able to count them to see if they're high or not. The higher they are, the more the liver's breaking down and the more pieces of it, think of it like sediment, the more like dirt that's in there, the worse situation it is. And there are times that you can get false readings where this can go up and down and change based on being sick and things like that. So there is different, there's exceptions to every rule. Nothing is set in stone. This is 100% this. It's all based on an overall thing. The patient, the situation, the lifestyle, what may have led to the cirrhosis, so on and so forth. So they start with a blood test, and they're able to look at that. They also look at your bilirubins, which tells them bilirubins is a byproduct that gets released that the liver actually is designed to collect and go out through urine. And that's what causes jaundice. That's what causes to turn yellow, like the eyes yellow, the skin yellow. That's the bilirubin going high, so they look for that. And this is all done through a simple blood test. They also check your clotting factors, and they'll also do regular blood draws that tell them where your blood counts are, and so on and so forth. So those are your basic initial setups. So let's say they find something, then they might order a scan, or maybe if you're like in my situation, where when I went in, it was already to the point where I had fluid built up, I had lost my muscle mass, I was yellow. So they obviously didn't need a blood test to tell that I was in liver failure. They did anyway. But they sent me through a scan, CT scan with contrast. That's where they put a fluid into it that kind of shows up under the scope. So it makes everything light up like a Christmas tree. So they were able to see better. And at that point in time, in my case, they were able to see that the liver was fully cirrhotic. There was no point in doing any further inspections as far as that goes, because they could see on that scan that it was completely cirrhotic. There is what's called a fibroscan. I've never had one done, and the reason why, like I said, I was already to the point where I was full-blown cirrhosis. And a fibroscan is generally done to see what level of cirrhosis you have, or to see where your liver is when it's already started to be affected by like fatty liver, or starting to get some scar tissue in there. Fibroscan is done through like an ultrasound type machine that they bounce waves off from, and that tells them how thick the shell of the liver is, and then they assign a number based on that. Like I said, I've never had this one done, but it's the procedure is simple. It's just a scan. And also the other one is an ultrasound, which I've had plenty of those. Also, if you've been diagnosed with cirrhosis, they're going to do an ultrasound probably every 6 months, or a CT scan to look for cancer, because when you have liver cirrhosis, your chance of it turning into cancer goes up a lot. So they do that every 6 months on me, and I'm sure if you have cirrhosis, you've probably run into the same situation where they're doing that every 6 months. So those are your scans. And there's also an MRI. They generally don't order an MRI unless they're looking for something else, because that's a lot more detail. I have had an MRI done. It's much longer than a CT scan. CT scan is pretty much slide in, slide out, maybe twice, and they're able to see the imaging, where an MRI goes really slow and you're in there for a while and it reads it. And if you're claustrophobic, that's not the test for you. You're in there for a while and it gets pretty warm in that tube. So it's not the worst thing in the world, but you do need to be patient, for sure. They also may do x-rays. A lot of times I've had a lot of x-rays done on my lungs to look for ascites, that is fluid buildup. I never really got it a whole lot in my stomach. I did the first time I went in. They pulled 5 liters off my stomach. After that, I never really had fluid build up on the stomach. It was always constantly the right lung. I actually had a chest tube in at one point for about 45 days straight, because the lung kept on filling up with fluid, and the fluid, I had an infection, and that continued to come back, and it wasn't going away. So, but long story short, back then, that was August of 2022. They gave me 90 days. And I'm still here 2 years later, so how much longer do I have? I don't know. Could be short, could be longer. I don't know. And, that's why I stay so positive, is I got to keep pushing, right? And that's the key. But anyway, back to what I was talking about. So the scans, so those are pretty much your scans that they do. And if I forgot one, please let me know in the comments. I'm not perfect here, and I am definitely not a medical professional. I can't even speak. However though, so those are pretty much your scans. Then they have procedures where they have an endoscopy. That's an EGD. That's where they go down and they check for varices through a scope. What are varices, Neil, you say? Varices are when you get portal hypertension. What is portal hypertension? Portal hypertension is your main portal vein artery that goes through the liver, that transfers the most amount of blood. It gets restricted by the liver, which I have that. And then it doesn't allow the blood flow to go properly. So think of it this way. If you were driving down the highway and there was, some backup, right? And all the cars were stopped. But instead of waiting, everybody starts taking dirt roads and they start driving through cornfields, right? To get where they're going. So they made their own roads. That's what your blood supply will do. It starts trying to make its own roads. And these things are called varices, and they're very dangerous. One of the leading causes of expiration is through bleeding out internally. That's why it's so important to have every 6 months or so to be checked for varices to make sure that you don't have any. I've had about 9 of them binded in the past. Luckily, I haven't had any for close to 2 years now. But I have had about 9 of them altogether. And so there's a lot of scar tissue that builds up and stuff like that. And that can cause other trouble. But pretty much what they do is they go in there, they inspect with the camera. And then if they find a varice, which again is this bulging vein, they wrap it with a band. And then that band cuts off that blood flow. And the band falls off and, well, it goes out through the exit. And that's how they take care of those. And generally that's pretty successful. You may wind up having a colonoscopy where they go in and, well, I don't need to explain this one, I don't think, but they make you drink a wonderful juice cocktail that cleans out everything you've eaten your entire life. So I've had one of those done. That is something that they generally do to check for any kind of bleeding or obstructions or things like that. I've only had the one done, and that was a little over 2 years ago. So I have a feeling that at some point the doctor's going to be like, it's been 2 years, time for another one. So I'm waiting for that to come up. Uh, so those are those procedures. Those are the most common ones. There are other ones that they may wind up doing, and everything's based on the situation, because the liver affects a lot of things. It has to do with your proteins. It plays a huge role in your protein. That's why it's so important to ingest like 200 grams of protein a day. The normal person only needs about 50, where when you have liver cirrhosis, it's like between 150 to 200 you need to take in. So that's 3 to 4 times the amount. And that is something you're going to discuss with your doctor, and your doctor will tell you how much protein you should be taking daily. Protein is super important. So it's very important to keep your protein up, stay active as you possibly can. Like me, I have other issues other than just the liver cirrhosis, which I'm going to get into an update here in a little bit because I just saw my specialist for my GI for my swallowing issue. But I'll explain that in a little bit. But you could have stomach issues. I mean, there's a lot of different other things that can come along with it as well. So it's so important to stay positive and to stay active and to keep that protein up and eat healthy. Don't go out to McDonald's or Wendy's or, any of those places. Try to avoid fast food. None of that stuff is really good for you anyway. I eat a lot of pulled pork, pork roast, and I'll just throw it in the slow cooker. And then, I may eat that for 3 or 4 days. I know it seems boring eating the same thing 3 or 4 days in a row, but also with my swallowing issue, with me being unable to swallow, which is not connected to the liver, by the way. So I'm going to get into an update on that. Don't think that if you have liver cirrhosis, you're going to lose your ability to swallow. That's not the case. I have a rare situation, as well as also I have full body pain that's from something else. I'm hypermobile, so I can bend my hands in funny shapes and stuff that most people can't. I can do a lot of really goofy stuff that shouldn't. Well, that causes deterioration in the connective tissue, and I have a connective tissue disorder as well, which may or may not have had something to do with the liver issue. Again, with the procedures, they may do some testing to find out what caused the liver cirrhosis. The most common one is hepatitis C, followed by alcoholism. And that's a huge one. But a lot of people think that it's only alcohol and that's the only cause of it. It's not. There are so many other things. I only drank for about 2 years. I drank heavier than I should, for sure. I went through a depression phase, and come to find out that it had a lot to do with hepatic encephalopathy, and that's a different video. But that is basically ammonia poisoning in your brain. They give you medicine for this to help stop that, by the way, once you get diagnosed. So there is hope for that one. But it was like somebody had me on autopilot for about a year, and I drank for, about 2 years. And, my liver doctor is like, your liver was failing much before you started drinking. He goes, you didn't do any favors, obviously. And you sped it along quite a bit, but, it had been failing previously. So another procedure they might do is a biopsy. They don't do biopsies very often anymore, unless they're looking for something specific or something uncommon. It's not very common to have doctors require that anymore. And the reason why, the imaging is so good nowadays that they can see pretty much everything, and they can tell the denseness just by doing scans and things. So generally they don't do it. They did order one for me, and the reason why is he's really looking for a underlying cause of it, because he wanted to make sure there was nothing else going on that could make it worse down the road or cause another issue. So that came out negative. There's no sign of any disease or anything that caused the damage whatsoever. But basically what they do it one or two ways. They may go in there, cut a little hole, they'll numb it up, cut a little hole, and then they'll go in there with a needle and they'll put the needle in, and then it pulls out a little core of liver tissue. Or what they did with me, they took 3 cores and they put the needles through, and it's connected to a gun, not a pew-pew gun, a spring-loaded one for to be able to pull the brain fog, hepatic encephalopathy. It's a great, wonderful thing to pull the core out for the liver test. So they did 3 times. They put 3 needles in, and they pulled it out, and it just sounds like a pop sound, and then they pull a core out. That was probably the most painful procedure. And I've had a chest tube. I'll explain what that is too in a minute. And having the procedure done, yeah, the chest tube was pretty uncomfortable for the 45 days I had it in, but it wasn't as painful. This was extremely painful, and the reason why is I bled for like 2 to 3 days, and that blood sat around my intestines and caused inflammation, and everything was just in pain. Now, it doesn't necessarily mean that that's going to happen to you. But in my case, I bled for those couple days, so it just caused more inflammation and more issues, and it was painful, and all to find absolutely nothing. So, but, I wanted to do what the doctor asked, so we did it anyway. Back to the chest tube. So the reason why I had a chest tube is because, like I said, my right lung kept filling up with fluid. This isn't a common thing. It is common to sometimes get fluid in your lung, especially the right lung when you have liver cirrhosis. These SETIs may show up there. But in my case, it was filling up so quickly that they put a chest tube in. And like I said, I had it for about 45 days. And they do this with a thing called a trocar. You can Google trocar if you want. It's basically looks like a giant nail. And on the end of it is like a tube. And they mark the spot and they put it in there and they hammer it in between your rib cage. I still have nerve damage from it. And they put that in, and then the tube actually only is in you about this far, believe it or not. But it feels like it's like, I don't even know. It feels like it's like wrapped all around your lung, but it's really not. It's only in there a little bit. I was really surprised when they pulled it out because you're awake for the whole procedure. But I've been through a lot of different procedures and so on and so forth. And I'm still here, and I'm still fighting and still pushing and still moving on. So a quick update for the people that have been following along. So I lost the ability to swallow food, which is not related to cirrhosis. It's something called achalasia. Achalasia is pretty rare. It only affects like 1 in 100,000 people, and they don't know what causes it. There's no underlying reason for what causes it. It can be caused by a lot of things. EDS, which is Ehlers-Danlos syndrome, is one of them that can cause it, and that's what I'm in the process of being tested for as well. Basically, sorry, my brain, you go through this process where you're trying to make all these videos, and then all of a sudden your brain just shoots off. But anyway, so what they want to do is they want to redo the procedures. They're going to do what's called a manometry test. They're going to run this hose, a metal tube that's got a rubber around it, through my nose all the way down into my stomach and make me swallow a bunch of times. And that's going to read the pressures. And then they're going to have me do what's called a barium swallow test. Basically, it's a milkshake with barium. And if you've ever had barium, it's like drinking chalk. It's pretty nasty. And they're going to have me sit up, lay down in different positions while I drink it. And they're going to watch it through a live x-ray machine and see how the fluid goes down and what it stops. The reason why he's redoing these tests, and they were done about a year ago, is because he wants to make sure, because there's no cure for this. Well, there is things they can do, but I can't have them done because of the liver cirrhosis. So he wants to make sure he didn't miss anything the first time, and that's why they're redoing it. So he's just being super careful and super thorough, which I appreciate. But the two repairs is basically what it is. It's the sphincter muscle, which is the door to your stomach from the bottom of your esophagus, and it opens to let food in and then closes so that acids don't get back up. You can have leaks in this and stuff like that, like you can have GERD or things like that, which come along with liver cirrhosis at times, but this is different. Basically, the door is staying stuck shut and it's not opening. So what they generally do is they would go in there and they would cut the muscle around and they would remove part of that muscle to open it up. Well, they can't do that because I had varices all in my stomach, and if they nick one, that's it. And the other thing is a feeding tube, and feeding tube is dangerous too, because once again, when they put it in, if they nick a varice, same situation. Also, if I get ascites on the stomach and it grows, the stomach gets bigger, it could pull that tube out, and that could make the fluids breach, and that could allow the fluid in the stomach to go into the stomach itself, or the fluid in the abdomen to go into the stomach, and that could be very dangerous, cause sepsis, can't speak, and other things like that. So I'm not sure what's going to happen yet. I know that every time eating something's a complete battle. It's very difficult to eat anything. So I've been battling along with this it started a couple years ago, and it's just gotten worse. And so I will keep everyone updated as that goes. Once again, thank everyone who has helped me out with my GoFundMe. I'm still working on the moving. I was able to get a vehicle. Thank you so much for your generosity and everybody who's helped me with that. And I really appreciate that. So now I've got a vehicle where I'm able to get to my doctor's appointments and all that stuff, which is excellent. The next step is finding a place to move. There will be a link to that GoFundMe in the description of this video if anyone wants to help. You don't have to. That's not why I make these videos, and I hate even asking, but I am on my own. I don't have anybody else to help me, and I'm trying to get to where I have friends, where I won't be alone, where I'm going to have that. Because in order to get a liver transplant, you have to have a support system, somebody willing to take care of you for 6 months. It's one of the requirements, and I don't have that. But if I move and able to do that, then I will. Plus, the hospitals there are way, way better. But anyway, thank you everyone for your time. Thank you for watching this video, especially if you watched it in its entirety. Sorry this one was a little bit longer. Everybody have a wonderful, amazing, blessed day. Stay positive, stay productive. Keep fighting no matter what you're going through. Just keep pushing, because you know what? You don't know what tomorrow may bring. It may bring something good. So keep going, okay? Have a great day.